वाहलुल उक़दतम मिन लिसानी यफ़क़हू क़ौली। अल्लाहुम्मा इन्नी अस्अलुका इल्मन नाफ़िअन रिज़्क़न तय्यिबन व अमलन मुतक़ब्बला शिफ़ाअ मिन कुल्लि दा। This is Dr. Zunaira Faiz. Today I am going to record part 2 of the gestational trophoblastic diseases, which includes invasive mole or the chorioadenoma destruens, and then there is the choriocarcinoma. By definition, it is a trophoblastic tumor with penetration of the myometrium by the chorionic villi. It is locally malignant and rarely metastasizes. It may lead to perforation of the uterus. A case of invasive mole inside the uterine cavity, the typical snowstorm appearance can be detected. The location of blood flow suggests an invasive mole. You can see here, this is the blood flow and this is the snowstorm pattern. The same patient, owing to the myometrial invasion, reduced vascular resistance is detected in the uterine cavity. Here you see the spectrum shows the reduced vascular resistance in the uterine cavity, a Doppler flow. Early features suggesting persistent gestational neoplasia or the post-molar syndrome include recurrent or persistent vaginal bleeding. Number 2, subinvolution. Subinvolution, the uterus does not go back to the pelvis in its normal position as it should be in the case of normal pregnancy. It takes time. Third is the amenorrhea and persistence of ovarian enlargement, no malignancy in endometrial biopsy. Chemotherapy started if persistent or malignant disease develop. The level of serum ACG doubles in 2 weeks after exclusion of a new pregnancy. Plateaus failure ACG, human chorionic gonadotrophin, to decrease over 3 weeks, or the test for the hormone becomes positive after being negative or if metastases appear. Invasive mole can be differentiated from the choriocarcinoma on 2 points. Number 1, invasive mole is always preceded by hydatidiform mole, while choriocarcinoma is preceded by mole in only 50% cases. Number 2, on histology, presence of placental villus structures indicates invasive mole, while their absence presents choriocarcinoma. Now, discussing the choriocarcinoma. By definition, a malignant form of GTD which can develop from a hydatidiform mole or from placental trophoblast cells associated with a healthy fetus, an abortion, or an ectopic pregnancy. So it is not only the grapes, vesicles, but also the fetus or part of the fetus, whether it aborts or the tubal pregnancy. Symptoms and signs: bleeding, infection, abdominal swelling, vaginal mass, lung symptoms, symptoms from other metastases. Vaginal bleeding, that is irregular vaginal bleeding which may sometimes be very severe and life-threatening, is the commonest presenting symptom and is the consequence of the tumor invading the uterine cavity. Amenorrhea. Patient may also present with a history of amenorrhea, which is caused by high level of ACG produced by distant metastasis. Abdominal or the vaginal mass, the primary lesion growing in the uterus can enlarge to the size which is palpable vaginally or abdominally. Features related to the metastasis: patient with pulmonary metastasis can present with dyspnea, pleuritic pain, hemoptysis, that is blood in the sputum, and pulmonary hypertension. Acute abdomen may be the manifestation of the liver involvement. Similarly, the patients with central nervous system secondaries may present with cerebrovascular accident, headache, fits, or the loss of consciousness. This purple deposits on the skin, they are sometimes seen. Now, if we see, as far as the investigations are concerned, beta hCG level is really high. Biopsy, though the histological examination of the tissue confirms the diagnosis, but biopsy is not recommended for the purposes of the diagnosis of the choriocarcinoma, as it can lead to the life-threatening hemorrhage. So it is really, after excluding the pregnancy, if the patient has grossly elevated hCG level, even without a history of mole, it is safer to treat her as choriocarcinoma than taking biopsy. Chest X-ray, lungs are the favorite site of the choriocarcinoma to metastasize. The characteristic radiological appearance of the lung secondaries is called cannonball appearance. This is very important MCQ usually in postgraduate and also undergraduates. Number 4 is the ultrasound. It is useful in localizing the primary pelvic lesion. Secondaries in the liver can also be detected. You can see in this Doppler image of the choriocarcinoma. This is the snowstorm appearance, and you can see how is the blood flow looks like. CT scan, MRI, CT scan or MRI of the brain is recommended where the brain metastasis is suspected. MRI is said to be the more informative than the CT scan. MRI and CT scan of the abdomen and chest may be indicated in some cases where it may give better results than ultrasound in X-ray chest. You can see here in this picture how is the metastasis look like and where the metastasis go. In the lung, in the brain, and here it is not only, it is the uterus crossing the walls of the myometrium, the uterus, myometrium and parametrium, and going to see here in this picture diagram, you can see it is invading towards the ovary and the fallopian tube, of course. CSF hCG levels. The measurement of the human core unit gonadotrophin levels in CSF is valuable in the diagnosis of the central nervous system involvement in the patient with choriocarcinoma. Now, as far as the prognosis is concerned, the outcome of the patient with the choriocarcinoma, the type of chemotherapy is determined by a scoring system which subclassifies the patient into the low risk, medium risk, and the high risk. I will not go detail in this. You can see in your text about how we can differentiate into the low, medium and the high risk. But as far as the treatment is concerned, it is the only curable cancer of the female genital tract. So choriocarcinoma, it is the only curable cancer of the female genital tract. Chemotherapy is the mainstay of the treatment. Surgery is only occasionally indicated. This is very important MCQ question, is usually there. Chemotherapy has really proved its worth in the treatment of the gestational trophoblastic disease, and virtually all the cases of the hydatid for mole, invasive mole and choriocarcinoma are curable when diagnosed early and treated with appropriate chemotherapy. Different chemotherapy regimes with single agent and combination of drugs are recommended for the treatment with the prognostic score of the low, medium and high risk. As far as the low risk patient, as I told you, they are usually treated with the single agent chemotherapy regime, and methotrexate is the drug of choice. Now, medium risk cases, we have to give the combination of the drugs in chemotherapy. Usually includes the etoposide, hydroxyurea, methotrexate, 6-mercaptopurine, actinomycin D, and folinic acid in a regime called ABACA, ABACA. Now, you can see the high-risk patients, they are given a combination of the multiple drugs, a number of regimes they are meant for them. There are different names, different multiple combination of medicines we are giving. But during the chemotherapy, we have to monitor the patient because there is drug toxicity is seen. We have to do the liver function test, electrolytes, renal function tests also, and also CBC whenever it is required. Now, after the chemotherapy, as I told you, it is a cancer which is curable by the chemotherapy. But surgery In the past, the elective hysterectomy, it was a popular method of treatment of the gestational trophoblastic disease. But now, in modern science, in modern era, we are doing this only when indications include, number one, persistent heavy uterine bleeding not responding to the chemotherapy may necessitate hysterectomy, and number two, uterine perforation requires local resection and repair. Here in this case, you can see where it's going to perforate, it is passing through the walls of the uterus. Drug-resistant disease limited to the resectable site may need removal. Now, the most important in this all is the follow-up of the patient. Patient is usually, we have to do the counseling with the patient, that we should be in contact with the patient, and this follow-ups, they can prevent the further any complication, and prognosis is 100% sharp. Jazakallah khair. With that, I hope you will take advantage of this today's part 2 of the gestational trophoblastic diseases.